Welcome to AGD 2019, the premier meeting for general dentistry. Facebook Live is sponsored by Henry Schein One. Hi everybody, I'm Sarah Panko and we're coming to you live from AGD 2019. Attendees are taking part of the many participation courses that are being offered here, and we're standing outside of one right now called Surgical Incisions, Suturing, and Flap Techniques. And joining me now to talk a little bit more about that is speaker Dr. Timothy Hempton. Thanks for joining us here today.
Hi, how are you today?
Good, how are you?
Oh, very good, very good. Yes, I'm very excited to be here with the Academy of General Dentistry's annual meeting. The program today is about, it's called Incisions and Suturing. And what we're attempting to do is to give people, the participants, a basic understanding of how to make incisions to gain access to problems around the natural dentition, as well as edentulous areas. So they're learning how to make incisions, preserve the blood supply when they do it, elevate flaps, gain access, and solve problems that happen every day in dental practices. So two of the things that they learned today, one is on how to do a basic flap with taking a margin of tissue on the buccal and then doing a sulcular incision on the lingual, elevate the flaps, access the bone, and then of course at the end they're going to be suturing the patients. The other procedure we're covering today is a free gingival graft, where they will harvest a graft and then place it on a recipient's site. The model we're using is actually a pig jaw. It's a pig mandible. So they seem to be having a good time there today and learning a lot.
That's great. So how will an attendee's practice improve once they complete this course?
Well, I believe there'll be two things that'll improve. One will be their understanding of why it is we do surgery in the first place. You know, there's a great need sometimes to gain access to osseous deformities that you can't access non-surgically. So I went through the basic principles and the rationale of why you would do this and how to achieve that. It gives them an opportunity to help patients save their teeth. I'm a periodontist, and so that's very important to me. Another thing that they can take back is an understanding of the importance of increasing the zone of attached gingiva, which also can have a lot of benefits for many reasons, the most of which is to prevent further recession. So at the very least, they'll understand how things are done, and hopefully they might even be able to go back and successfully repeat this in their office. Certainly we'll take a little rehearsal here today, and when they leave, I believe they'll have a good understanding.
Yeah, that's great. So, and how is the participation course format beneficial to a dentist?
Well, I'm a big believer in simulation. I've been practicing for 32 years, and I do a lot of photography in my own work, and I do courses like this, and quite frankly, I'm convinced that working on models or, sort of cadaver type specimens is a great way to sort of get a great idea of how things should be. Because when you're in the office treating a patient, there's a lot of other factors going on. So one of the things about this is they're taking time out of their office to sort of sharpen their intellectual skills. I'm a big believer that in terms of teaching, one should come up with the idea that everybody has three eyes, two in the front of their head and one in their mind's eye. And when you're looking at something, there's a lot going on. It's hard to maybe sometimes zero in on the problem. But in your mind's eye, through simulation, whether it be on models or, cadaver jaws, you have an opportunity to sort of get set in your head about what it is. Plus, it also gives the dentist to understand the checklist that they need to have for doing procedures. So today we went through that checklist so that when they go back in the office, this rehearsal will have a great benefit. It's similar to what pilots do when they fly planes. A lot of times what airplane pilots will do is they do flight simulations to stay sharp and focused. I believe the same thing works here.
Wow, that's great. This is really neat. We're excited to see it. So I'm going to send you back in so you can keep teaching. Thank you very much.
Thank you so much for having me today.
Thank you. So let's take a closer look at what's happening here inside with Dr. Hempton.
Come to the front of the room. I'm coming. Let me put these on so I can see better. I'm sorry? I think quick on my feet. Hopefully I did a good job. So let me get some gloves. Where are they? Alright. Let me switch back.
It's just because it's thin flap type.
Yeah, the problem is when tissues are super thin, and if they overbrush or if they have lousy poor plaque control, what can happen is you have a potential for they can tissues to continue to recede. So we're simply trying to thicken the tissues against bacterial plaque, which can cause inflammation and possibly cause recession if the tissues are really thin, or abrasion from toothbrush abrasion. Does that make sense?
It is. We're not trying to ape or clonally reposition.
Not in this
small-
particular.
Okay.
We're simply doing a basic procedure, trying to increase the zone of attached gingiva. That's what we're trying to
And
do.
once you transplant that tissue in there and it thickens up, you will have no care next to it.
I just showed you exactly. That's exactly what happens. We'll increase the zone of tissue and get thicker.
But no, I think that's, it's a great, be selective of which ones to do. It works.
And that's just a sneak peek at one of the many participation courses being offered here at AGD 2019. We'll be back live at around 12:15 for a look at the oral cancer screenings that are taking place here. But in the meantime, thanks for watching AGD Facebook Live, sponsored by Henry Schein 1.